I'm Dr. Mitchell Kim. I'm a general dentist at Modern Dental in Richardson. And computer aided implant placement has really changed the game as far as accuracy and predictability for our patients receiving dental implants. It really helps us to plan the placement and the position of the implant within the patient's jaw in a really accurate and precise manner, helping us stay away from vital structures such as nerves, arteries, and other, structures within the head and face that we want to stay away from. And that really determines the long-term success and viability of that implant for the patient. So really, computer guided surgery means obtaining information digitally. So that includes taking a 3D x-ray, which we call a CBCT scan, taking digital scans of the patient's teeth, and then overlaying them together to give us a more accurate idea of bone levels that we're dealing with. Are there areas of infection that we need to address first? Are there nerves, arteries, other blood vessels, things that we need to kind of keep in mind and stay away from so that we can really maximize the success rate of the implant long term. Traditional implant methods typically do not involve as much use of digital technology. They may be limited to taking a two-dimensional x-ray. They may be using physical impressions with putty to kind of plan their case. And there can be variables where the models may not be as accurate. If there's any distortion in the impressions, the patient may not be able to take a proper impression. They have a very sensitive gag reflex. A lot of patients have maybe smaller mouths that don't accommodate taking an impression accurately. And so if you don't have an accurate set of data to work with, then you're not really able to really predict, is the implant going in the proper position? Are we staying away from vital anatomical structures? And are there areas that we may need to even focus on before trying to place the implant, resolving infections and abscesses before really placing a dental implant? Things like that really, really deteriorates the success rate for people trying to get a dental implant to last many years after the surgery is complete. It's really visibility. Being able to visualize where you're trying to go really helps you, lay down the road for success, and really gives the patient confidence in what they're about to get done themselves, seeing where the implant's going to be, understanding that we have enough room there, and why we may recommend additional procedures. Maybe an additional bone graft is needed, or maybe we need to segment their procedure into steps that may lengthen the plan but will increase their chances of success for the implant in the future. And being able to kind of look at it together with a patient, they can see what you're seeing. They'll feel more confident and comfortable actually coming in for the procedure itself, and it really makes for a lot of stress to be reduced in this process. Well, actually, one that happened last week, we had a patient that came in. She was missing one of her front teeth, and she had very little time as she's a school teacher. And so, it being spring break here in Richardson, last week was ideal for her to come in and spend some time with us. But being able to get everything done within the same visit, meaning planning the placement of the implant, making sure that we're able to position it properly. There's very little wiggle room for not placing that implant in the proper position, and also being able to temporize it so that it appears as if there's an actual tooth there instead of having the patient have to walk around with a missing tooth in that area, which is important for a teacher, obviously, being in front of people all day, every day during the week. And it was really helpful for her to be able to get everything done. She feels confident about, the process and what she had completed. And really now it's just about healing. So, we'll wait a couple of months and have her come back, and then we'll kind of see how things are doing. But in the meantime, she has a tooth there. And as far as anyone else could tell, she probably could say, I never had surgery. No one could really tell. But that's all thanks to being able to get proper plan in place, utilizing our technology that we have in the practice to be able to deliver, not only the implant, but a provisional crown to go in the implant to make it look like an actual tooth, even though it's in the healing stage. First step is to give us a call. We can always set up a consultation visit. It can be as short as 15 minutes. It can be as long as the patient needs, depending on how many questions they have. We'll offer to take a 3D scan so we can assess the area where we're considering an implant, take a digital scan of their teeth, and kind of go through the planning process. We can also help with financial questions if they have dental insurance, or a coordinator can look into their benefits and see if it's something that is covered procedure. So a lot of things can be covered in one visit. We just need to schedule a consultation to kind of start that process.